Welcome to the AUA News Inside Tract podcast. Today's Inside Tract podcast is part of the Global Perspective series, which is brought to you by the AUA International Programs Department. We'll hear from scholars of the past and present as they talk about what they've learned, how they plan on applying those lessons, and the impact of international collaboration on their professional growth, research, and patient care.
Welcome to AUA News Inside Track. I'm Soroush Rais-Bahrami.
And I'm Mohummad Siddiqui. We're excited to kick off a brand new series called Global Perspectives, where we explore the AUA's academic exchange program and the impact it's having on urologists around the world.
In this very first episode, we're sharing our own experiences with the AUA Exchange Scholars Program in Japan, what we learned, what surprised us, and how the international collaboration is shaping the way we practice urology today.
This program is made possible thanks to the generous support of Teleflex, a global leader in medical technology and a proud sponsor of the AUA Academic Exchange Program.
So whether you're a practicing urologist interested in applying to one of these programs, or a resident trainee curious about global trends, or just someone who loves hearing about medicine connecting us across all borders, you're in the right place. So I'll go ahead and kick off a question. Minhaj, can you share with us what initially drew you to apply to the AUA Exchange Program?
Yeah, this this is actually the second exchange I've done, and so I have done an exchange where I spent some time in England. And that was an incredible experience. And so I'm partial. Like, you really, when you see medicine being practiced in a different country, it turns out that, the foundations of what we do are the same. The biology is the same. And yet the implementation of the practice and how culture interacts with practice of medicine is so different. And I think that I caught the bug by doing the English experience, and then when this opportunity came up to see what it's like in Japan, where really actually the cultural differences are even more magnified, I was really excited. So I made sure to kind of put my hat in the ring and apply, and was really excited when I got the opportunity.
Well, likewise, I felt the similar draw to see cultural differences in the practice of medicine. In our subspecialty, we know that there's different innovation going on all across the globe, and that was really what drew me. Plus, I had heard so many great experiences from yourself and other colleagues that I had worked with, trained with, that have had other exchange experiences through the AUA or other societies, and that's really what drew me, and I was lucky enough to also be selected.
Yeah, it was kind of cool, right? Like, because the two of us have known each other. We were co-fellows together. It's worth mentioning, right? And then we've gone our parallel paths now, but we didn't know we were going to end up being co
exchange scholars, right?
Programs. Yeah, exactly. Yeah, so that was a fun little add-on. The other program we did not have kind of a counterpart, and so the AUA program having two people, and kind of the experience of having another kind of similar stage of career program fellow to share the experience with is also a really kind of cool aspect of this.
It was definitely great news to not only find out I was selected to participate in the AUA-JUA exchange, but also finding out we could be traveling together in parallel paths, and then ending at the JUA annual meeting in Fukuoka together to present our work and our experiences and have that cultural experience at the end of our exchange.
Totally. All right, here I've got a question now. So what were the expectations before traveling to Japan, and how did the reality compare for you, Soroush?
Well, I'd heard a lot about the Japanese culture, even outside of medicine. Really astounded, and did a lot of homework. I downloaded Duolingo and started attempts at learning Japanese language. But I will have to say it was my first trip to East Asia, and it was a phenomenal experience, and everything that I had expected was more than fulfilled in terms of the travel, the experience, the immersion, beyond the medical experiences, which are phenomenal, I'm sure we're going to talk a little bit about the interchange of science, food, arts. I was hosted in Kyoto at Kyoto Prefectural University, and it was a sanctuary of culture, even within Japan. So it was a phenomenal experience. I learned a lot, and I look forward to ongoing touch points with colleagues and friends I've built through this program in Japan, not only in Kyoto where I was hosted, but throughout the country where we had a lot of interchange during our trip there.
Yeah. Yeah. I mean, that was a kind of fun piece of this too, that, we didn't, when you apply, you don't know where you're going to end up. And you just give them some preferences on, or like your background. They try to match you a little bit. Uh, so, I got matched in Tokyo, and I mean that was also super fun. And so I was at GK University, and they were just like excellent hosts. And I think uh, like you, I'd only been to Japan once, and I mean, funny enough, like for me, both trips to Japan in my life have been like work related. So I went for World Congress. Maybe I think that must have been like 12 years ago now. 13 years ago. I was a resident actually. So yeah, and that was in Kyoto, and then this time I was based out of Tokyo, and so I knew a little bit about Japanese culture, and but this time around, I think we spent almost 2 weeks there. Really getting that immersion was really great, and I think I knew it was a hospitable culture. They absolutely lived up to that kind of hospitality, and it was awesome.
Beyond belief, absolutely. Well, I'll dive in. What were some of the most striking differences that you saw in clinical practice? I know we talked about the cultural experiences and how the travel compared to what we expected, but what did you see clinically in Japan and compared to how we've trained and how we practiced in the United States?
Yeah. So, I mean, this was really striking in my case. So I got plugged in with, in practice, what I do right now, I am a urologic oncologist. Like you, we both did the SUO fellowship at the NIH, and specifically at the NCI. And so I do a lot of prostate and bladder cancer. Uh, there's and and they do those surgeries there. But patients get prostate and bladder cancer and kidney cancer in Japan also, and in in many ways it was really funny that the kind of functioning of operational processes of like how you get in the OR. They're a little different, like you're changing into these various scrubs all the time over there, and like you have to like put on these like special slippers, and I don't think there's a lot of size 12. Yeah, I'm telling the world my shoe size, but like it was a funny kind of thing that not a lot of people would like my shoe size over there. So like we had this kind of funny dynamic. But then you get in the OR, and it's almost like you're exactly where you're used to being. So that was fun, right? And so all of a sudden you're seeing the robot, and it's just familiar territory, and it's just kind of back to being like another day. And you're kind of hanging out with the team, and there's residents and students, and you're kind of talking about stuff, and you're someone who has some experience. And so like a lot of I actually as much as I was interacting with colleagues, attendings, I was also interacting with a lot of students and residents, and I pointing out things that I'm seeing that I know the same thing I do when I'm here, and I have residents and students in my room here, and that's kind of familiar territory. And then we see what happens to the patients post-op. And there's like a really interesting interplay of culture, expectations, in Japan, especially in this, GK University is a private university. These patients, they pretty much expect to be in the hospital until they're tube free. It's just a different cultural kind of perspective, and so they're in the hospital for like 1 week for a prostatectomy, for up to like 3 or 4 weeks for a cystectomy, and then they've got rooms that, I mean, it's almost like, I mean, they're recovering the first few days, but after that it's almost like a hotel room, and they're like kind of walking around and stuff, and they're doing pretty well, but they're just there because they have like a Foley still. And that's just, I talked to a lot of, like, I shared like thoughts. I talked about how like we're doing same day discharge now on like a lot of our prostates, and and it was just kind of a fun exchange of astonishment of our two practice patterns. They were astonished that we're sending patients out so quickly. I was astonished how long patients staying. They said that that's what patients expect of them. And I said, I don't think any of my patients would stay, but I think that type of cultural expectations come into play. So it was, and then there's a lot of other stories like that, but that kind of back and forth was really a cool part of this experience, just seeing how medicine is practiced so differently.
I think a lot of that speaks to the culture, like you said, also the finances of medicine probably being very different than what we encounter in the US.
It's a great point. Yeah. Yeah, no, it's a centralized healthcare system there. So you see the impacts that there's central policies. So they currently don't do PSMA PET scans in Japan, other things like that, and that's mandated through a centralized system. Yeah, absolutely.
My primary host was Professor Kimura, who we both know in Kyoto, and saw similar dynamics where a lot of the things that we would see as standard options for either diagnostics or therapy and urologic oncology, like you said, are being done on clinical trials. But I experienced that the clinical trials are very robust, at least where I was hosted, multiple ongoing clinical trials for various focal therapies, new robotic platforms, the Hinatori robot that is built in Japan and commercially available, but really expanding indications and ways to sort of progress the technology. It's amazing to see how the AMCs there compared to ours are advancing science and clinical care as well, which is always great to see different insights of that happening across borders.
Yeah.
One thing I don't know if you noticed, we're in Kyoto Prefectural University, I saw very integrated learning mechanisms. And so an operating room very commonly had up to half a dozen to a dozen learners at different levels. There were junior faculty oftentimes observing cases when they weren't in clinic or doing their own cases. There were fellows, residents, students, and even post-bac students looking to go into medical fields of practice in the operating room. And it really was eye-opening, the amount of investment and pipeline mechanisms of education, even for those, again, before nursing or medical school, that were present in the OR and really integrated into that clinical sort of fold.
Yeah, I couldn't agree more. Actually, the GK University also had a very similar vibe where it was so organized, and there was definitely a it's a very large residency. I forget the number now, but it's a massive system, and there is kind of this longitudinal continued um, uh, mentorship and education experience, and certainly students and residents coming in and out and doing their thing, but uh, a really structured system with junior faculty and senior faculty, especially in like complex cases where they're like really doing these cases together, and which is, I would say, certainly we have that collegiality and collaboration here, but not as an institutionalized, organized thing on every case as it is over there. Over there, it's just part of the culture that pretty much all the major cases they were doing that. Yeah, and so that was also it's just a different way to do it, and it's cool to see, like, they've got it working well there, and it's cool to see kind of a group of people organizing care in such a way, and it implementing it well.
And a huge multidisciplinary push. I saw that the urology service managed all specifically urologic cancers.
Yeah.
The systemic therapy, the residents and faculty in the urology service and urology department were managing chemotherapeutic regimens. They were managing radiation, post-radiation side effect profiles. So again, the culture of really having a large admitting service, and again, maintaining post-operative patients, but also maintaining the journey of care, especially for those with urologic cancers. They at any point had no less than 20 to 30 patients on inpatient service.
Yeah.
And that was one of several hospitals in that system.
Yeah. Yeah. GK had 100 on their census, right? And like, you have to take into context, some of them were, post-op day 27 cystectomy, but they certainly also had metastatic. I'm glad you mentioned that. It's true. They are the entire tumor board over there. They are the med onc. They are the surgical. The medical oncologists.
They're all integrated.
They're integrated. It's a different system. Yeah, like you don't have separate medical oncologists for disease. It's actually the same doctor.
That when each of the services ends up being 20 patients, when it's the primary surgical, primary follow-up systemic therapy. And then we also had a transplant service that again was kidney transplant, was completely integrated into urology. So it was very eye-opening. Like you said, suddenly if you took the whole urology department's inpatient service, it could be very large, with each of the sub-services at the same hospital had somewhere over 20 patients.
Yeah. No, I came back and I told our residents, things can be harder. You could have
It's different rather than discharging same day or next morning. It's just a different dynamic of managing patients along their pathway of care. But that was also some of the stuff that I recognized, coinciding with what you said.
Yeah. All right, here, let me give you the next question, Soroush. Were there any cultural moments outside the clinic that stood out to you or shaped your experience?
Yeah, well, you've known me like we've talked about for a couple decades now, and I'm a food experience person. I get very excited, and I will say that beyond the clinical experiences, the food experience in Kyoto, also traveled, as we'll talk about, to the annual Congress there in Fukuoka, and then a day trip I took with the team to Nagasaki. The food experience and the differences in subculture of food across the different islands and cities was fabulous. The absolute freshest seafood I've ever had in my life. Going to some of the seafood, the fish markets, and having fresh seafood every place, from formal sit down restaurants to the alley streets and markets with food stands. It was phenomenal. Also, being in Kyoto, really the center of preserved culture for the entire dynasties of Japan. The integration of big city life right around temples and shrines, all immersed with one another, and obviously being in a place using a lot of public transportation and walking around the whole city. The best experience is to see all of a sudden a park to walk through, a shrine or a temple to visit. And very near to town, I had opportunities to hike up Mount Hiei. Also took a day trip out to Lake Biwa on a weekend and did biking and hiking around the lake. So fabulous experiences in terms of the parks, the natural layout, and then the immersion of culture within a big city, and the historic nature of how spirituality and culture was just into the big city dynamics was phenomenal.
Yeah, I mean, I'm going to echo. I think as much of a memorable part of this experience was, we had the weekends free, right? And really we and the evenings. And so when you add all that up, there was actually a fair amount of time to explore. Japan is a very easy place to get around. The train system there is just incredible. I did a day trip to Mount Fuji. I'm an avid cyclist. And so I found like a nice little loop to kind of cycle, not up, but just around the the mountain area, and that was, there's a big lake in that area, so that was super super cool. I'll always remember that. Like, being in Tokyo, the same as you, kind of the mix of culture and amazing food. The hosts. So Dr. Kimura is the chair, and him and other kind of faculty and the residents. We went out one evening for like a dinner together. I also did lunches with the residents,
Yeah.
like in different shifts every day, and super memorable. The dinner, and they took me to this like kind of seafood district. It's like a famous seafood district in Tokyo, and at this is like a traditional Japanese meal where you're kind of sitting on the ground. I've never done anything like that, and you like take your shoes off at the front door, and you're kind of sitting formally on the ground, and then they brought out this tuna, like the actual like back of a tuna, and you have like a seashell, and you're getting fresh tuna, right there. It was just like super cool. I've shown that picture like to everyone I know, and I think everyone thinks it's amazing. And uh, and actually on the way to the conference, right? Because our conference was Fukuoka. I stopped by Kyoto too, and then uh, actually, as we kept going on train, Hiroshima was on the way. So I made a day pit stop at Hiroshima, and I mean, that's a city where it's steeped in history, and it was a really kind of impactful experience for me, to be there, to see the kind of atomic dome and all that stuff. And so, and then and it's having the opportunity to see all these different cities and seeing subtle differences. Like, Tokyo is totally different than Kyoto, is totally different than Fukuoka. So all of it was just a true highlight of the experience.
Sounds like we both had great experiences using that weekend time, getting away, whether it be out of town to a different city or just the natural spot to explore a lot of things that we had an opportunity to do outside of the clinical sort of research exposure.
Totally. It's a big part of the program, I think.
100%. So, how do you think the exchange influenced your perspective on global education, global urologic research, and connectivity there?
It's actually had a lot of influence on it, in that I think it's hard to have understanding and awareness of what education and research is like for for our colleagues in these other countries, until you've had a little bit of exposure to their world. And so, in Japan, actually, a major part of training, especially for, I think, people who go on to become academics, but not just the academics, I think, like, I think people who also become senior in their specialties, is to have done external rotations. Yeah, the same version of what we did, but actually longer. Like, they go for 6 months or a year or whatnot. And so, but a lot of the senior colleagues would actually introduce themselves and their training backgrounds, and would often mention where they had spent their year outside of Japan. And they would say, "Oh, I spent it in New York City, or I spent it in, Vienna, or I spent it in, all these various places."
100%. I saw the same thing. Most of the senior faculty were introducing their international experience where they did a fellowship or a mini rotation for about a year.
Yeah, it's just part of the culture. It's really cool. And so, um, I know that now, and I think like I've built these relationships with Japan, and I'm actually trying to foster here some kind of collaboration potentially with some of the people if they're interested in coming to this area, and like we've been talking about that, and so I think it has opened up a lot of avenues. There's now these new relationships that I mean, they come to the AUA. I mean, AUA has this very big international attendee base, and many of the people that I got to know regularly come to the AUA, and so I look forward to kind of connecting with them when they come here. So that's in a form going to be a way to maintain this tie to international urology, and also just opening up these kind of channels and understanding how things work out there, and how actually research and education is incentivized, particularly in countries like Japan, um, to be collaboratively internationally. And so that as someone who in academia likes to collaborate and likes to do research, uh, it's nice to know that, because it opens up opportunities on our end to also foster and support that kind of interest. How do you think, Soroush, that international exchange programs like this one benefit the broader urology community?
Absolutely. I sort of follow along the line that you brought up, that beyond our clinical advances and picking up new tricks of the trade that colleagues are doing just as another expert in the field, it really opened crosstalk for the education and the research, and those go hand in hand. Those things that are advancing our clinical practice by educating our next colleagues, but also advancing the research. And you mentioned how there's such an ingrained process for the Japanese learners as they're, late trainees or early faculty to do time abroad outside of Japan. And this was a great experience, not nearly as long as a 6 month or year long or 2 year long, international exchange fellowship, but this has built inroads for those relationships, at least for myself, just like it has for you, building collaborations, building multi institutional, but also now international research collaboratives with colleagues. And as you mentioned, already in talks of how we can host colleagues that we met there, or the next generation of our Japanese colleagues that are being trained at the institutions that hosted us, or collaborators of those institutions. So these international exchange programs bring us all to one place. And both of us have dabbled in mentioning that our programs ended at the JUA annual meeting, which was hosted in Fukuoka this past spring. But that experience at that conference, you and I both met Japanese urology leaders from all different institutions throughout the country. So it was beyond our host institutions. It was the who's who of Japanese urology, and that further increased our connectivity, really, for the research opportunities, the educational cross talk in the future. And that was a really exciting program. Beyond that, we really got to meet with our AUA leadership at that conference, as you remember, Dr. Penson, Dr. Sandu, and the JUA leaders, president of the Japanese Urological Association, and the entire cabinet of executive leaders of the JUA, really were such gracious hosts for us as exchange scholars. We also, at that conference, had the opportunity to work with exchange scholars from the EAU, who were also presenting their work and their exchange experiences that culminated at the same conference. So it was a great ending to bring everyone together, from obviously our AUA contingent, our EAU contingent, all visiting Japan, but also the leaders at the JUA. I feel that was equally valuable long term to the actual experience at being hosted and learning from the clinical exposure of one institution. So I think that was super additive for me And coming home right after that conference, we had the experience to go to AUA, obviously, the week after. And many of our friends and colleagues who were either at our host sites or those we had met at the JUA were now at the AUA annual meeting. So it was phenomenal to keep those relationships in short order going just a week later. And then obviously through the global world we live in, whether it be email and FaceTime and Zoom, still connecting with our colleagues and building more inroads for cross collaborations.
Yeah, yeah. I mean, the JUA was a blast. It and everything you mentioned is like really spot on. That it had so many cool facets, and it was just this perfect complement to the experience of kind of being immersed in Japan and immersed, going deep at one site, getting to know people at that site, and and the residents and students and the faculty, and then now you're really getting exposure to the entire breadth of the country's infrastructure, like and I think honestly, before this year, I did not actually appreciate the degree to which i- international collaboration and international colleagues engagement is such an important part of AUA. But after you do a program like this, you really start to understand that process, and the fact that the AUA sends its two of its kind of top ranking officials, and um, doctors Penson and Sandhu in this cycle to this conference every year, right? And so as a scholar, you actually get. I mean, we hung out with them for hours, right? Like we went out and sat like and just kind of chatted with them, and that's the first time I really got to know them that well. We went to that baseball.
Yeah, both in a formal arena in the
Yeah,
conference,
yeah,
in different strategy meetings with the JUA leaders, but also being hosted at a local baseball game. We got to just
yeah. In
uh,
Super Party, what was it called? It had like the coolest name ever. It was a private suite. I mean, like the Japanese are just such incredible hosts. They put us in like a owner's box suite, right? It's called the super extra fancy party suite. Like funny name. Took a picture. But yeah, I mean just being able to do that, right? And so for the tail end of the experience, in my situation, my wife was actually able to join me. She flew in and she got to kind of share with this, and that was kind of a for me a really cool part that to like the JUA and as we were kind of training down to Fukuoka, we uh, she was with me, and I've heard that some fellows have done that, some have not, and that's very much a welcome part of the program too. Um, and so yeah, I think like that and seeing, you go to conference and actually the stuff being presented at the conference, I mean, some of it is really interesting, right? And in the space that I pay attention to, like some of these talks, like some of the work that they're doing in Japan is really cutting edge. There was like some cool stuff on AI going on that I hadn't seen before. Image, especially like kind of MR prostate kind of recognition stuff, and it was really great. So I think from all of these perspectives, it was a great exchange, um, and I think the exchange program, really facilitated all those interactions.
it really planted the seed well, and during even a short 2 to 3 weeks, 2 weeks approximately at our host institution, and about just shy of a week at the conference, it really brought it all and brought it together. So it was phenomenal. And in summary, I would say we both had a great opportunity that was afforded to us through the AUA and the JUA sponsoring this exchange. I would do everything to recommend colleagues to consider this program. It was the exact same sentiment I had gotten when I talked to others who had participated in the AUA exchanges with obviously Japan, but other international hosts that the program supports. Certainly, I would say the same thing that got me into it, which was word of mouth, and the opportunity to hear about these great experiences is the reason why everybody should think about these opportunities if it's their career and their personal schedule to consider applying it. It's probably one of the most fruitful things that I've done in my training and in my practice so far.
Yeah, yeah. I'll just echo that. I mean, I think, it's not easy. You do have to kind of cut out a not insignificant chunk of time, and you're doing it kind of 5 to 10 years in, I think, into your career, into being a full faculty or full practicing urologist, I guess, depending on like the setting you're doing it in. Um, so that's for most people, that's a pretty busy time. I mean, you have to kind of carve out that clinical time and other responsibilities, and then family, and all that stuff. But if it aligned. This year worked out really well for me. It aligned with a whole bunch of things, and it was clear to me that it was just meant to be this year. Like previous years, I'd been interested, but it just wasn't meant to be. This wasn't going to happen, and I'm so glad that it worked out. It really is going to be a memorable experience for me. I would do it again in a heartbeat.
100%. Well, I'll sort of close out now saying thank you for joining us on, again, this very exciting first episode of Global Perspectives, the AUA podcast.
Stay tuned next month as Dr. George Koch and Niels Johnson talk about their experience with the AUA exchange program in India.
All right. Thank y'all.
Take care.
This has been Global Perspectives, an AUA News Inside Tract podcast brought to you by the AUA International Programs Department. For more information about AUA's International Exchange Program, visit auanet.org/exchange.